Andarki na namaskaram. Very good evening. I'm Dr.Virinchi Sharma, consultant psychiatrist from Hyderabad. One of the biggest battles that we have been facing in today's world in regards to mental health is to COVID. This can be categorized into three parts according to our clinical experiences. We see a lot of people coming to the hospital with a fear that they might get this particular infection. So because of this fear, we see a lot of people having anxiety, we see people with depressions, we see people with sleep issues, and especially we see people with an increased obsessive behaviors of frequent washing of hands or sanitizing their hands. Well, the second category is people who have actually got the virus. So who's got the infection, somebody who's tested COVID positive. Undoubtedly, a lot of thoughts come into their mind at that particular point. Once somebody gets to know that they are COVID positive, the greatest fear is, are they going to survive? Can they come out of this virus? Do they have to land up in a hospital? Will they get enough oxygen? Will they be getting a ventilator bed? And what is going to happen to their kith and kin? So these are some major doubts which a lot of people come down with. And the third surprising category is, we see a lot of people developing neurological as well as psychiatric conditions post-COVID infection. We see a lot of people coming with continuous anxiety even after the illness, or continued sleep disturbances, or depressive episodes. What we need to understand is, mental health is one of the most important aspects during a pandemic like this. WHO back in 2020 clearly said that after COVID, the next pandemic is going to be a mental health pandemic, and we are almost seeing this all around the globe. To prevent these issues from happening or to protect your mental health, one must understand that there are some activities and some lifestyle changes that we all need to bring in. If you look at the WHO definition of health, it is physical, mental, social, and spiritual well-being. So these four dimensions have to be activated on a day-to-day basis. At least 40 minutes of a physical activity, spending at least 30 minutes to 1 hour on relaxation techniques and meditation, utilizing the technology and increasing your social interactions with loved ones, as well as believing in religious and spiritual activities which can actually calm your brain down. All these activities increase the positive chemicals, the happiness chemicals, and prevent you from getting into a mental health issue. Thank you.
And want to discuss what can be the pros and cons of pushing the fertility further. Now, in them, when we see that the lady 35 years plus, a lady is born with a fixed set of eggs, which is around